Welcome back. It is time now for our medical moment. In today's checkup, we're examining different ways you can kick the habit of smoking. According to the World Health Organization, tobacco kills up to half of its users. The American Lung Association says 480,000 people in the U.S. die from tobacco-related causes each year, making it the #1 cause of preventable death in the country. Wow. But this doesn't have to be the case for you or someone you know. Joining me in our conversation today about this cause, Ann Worley, a nurse navigator with the Covenant Healthcare Cancer Center. And we are so glad to have you with us today. Want to talk about, first of all, why is it important to quit smoking? For a lot of people, it's so hard.
Right. And smoking just is related to a wide variety of health conditions, heart disease, diabetes, peripheral vascular disease, and more deadly illnesses like lung cancer.
So how can someone start quitting? How can they start that hard process?
Well, you have to examine, are you ready to quit? Is this something you're really motivated to do? You can tell a friend, so you're not the only one that knows you're going to quit. Set a date. Make sure you talk to your doctor, see if there's anything he can do to help you out. Get a plan going. And then when you get to that date, make sure the people that know that you're going to quit are there to support you.
Sure. Now, tell us a little bit about the smoking seminars that you guys offer at Covenant. They're free, right?
Right. We offer them 3 times a year. Our next one is coming up on September 14th. Basically, our respiratory therapy staff does a health screening for your lungs while you're there. They talk about the different options that you can use to quit. And then if you'd like to, you can sign up for a free 4-week class to help you quit smoking and set that date.
What are the requirements for that? Anything in particular?
Nope, you just have to be a current smoker who really wants to quit.
Now, in your role as a nurse navigator, what do you find motivates folks to quit? You mentioned having somebody to hold you accountable, kind of like a weight loss journey. I would imagine it's similar to that. But what do you find works? Is it support groups or?
Well, it's usually a combination of the group, counseling, the help of your physician, many times a nicotine replacement, and knowing that the thought process is that you may have to quit more than once and being willing to, if you fall off the wagon, quit again. Sometimes an illness, if a patient finds out they have lung cancer, or if there's a new baby coming into the family, sometimes those are really motivating times for patients to start quitting.
To want to do that. All right. And thank you so much. Is there some place or somewhere that folks can call to learn more about these resources?
They can call the 1-866-COVENANT phone line to sign up for the September 14th class. They can also call me at 989-583-5014 if they want more information for our smoking cessation class or our lung cancer screening program.
Wonderful. And thank you so much for joining us. And for folks watching at home, again, if you or someone you know wants to quit smoking, there are resources available to you. We will also post what Ann and I just talked about in the hot links section of WNEM.com.